SADPI argues that jailing drug users does more harm than good. The initiative wants drug users to be placed under medical care. For more on this, I'm joined by Dr. Keith Scott from the South African Drug Policy Initiative. Very good morning to you. Talk us through how this is all going to work.
Well, I think the easiest way to understand it is to look at the way we regulate alcohol. Alcohol is one of the most harmful drugs of all the drugs, including all the banned drugs. And it is legal, it is regulated, you have to be a licensed manufacturer, vendor, and you have to have a certain amount of purity. And it's worked for years, and banning it never worked. They tried banning it in the Soviet Union and in the USA, and it caused an increase in crime and problems with the economy, etc., etc. So that is the easiest way of looking at it, and that's what we want to move towards, putting all these illegal drugs in the same regulatory framework as we use for alcohol or similar.
All right, and how would you do that? I mean, how do you get to work with the how do you get to work with the drug users and the drug providers?
Well, there are different ways of doing it. As with alcohol, different countries have different ways of regulating alcohol, some more liberal than others. The first thing I'd like to emphasize, whatever I say, children should not be allowed to use drugs, the same as with alcohol, and obviously you determine an age cutoff for that, 18 or 21. And so children would not be allowed to use drugs. The drugs you would have to be licensed to manufacture or sell a drug, as we do with alcohol. And one would have to fit in the different frameworks as we have. We have local bylaws that regulate alcohol, we have national laws, etc. So the concept is very simple. If we just plug those drugs into the alcohol framework, and for certain drugs we could say they could only be dispensed by pharmacies, and other ones possibly prescribed by doctors, depending on the potential harms.
Are we talking about all sorts of drugs?
And then, sorry, can you repeat that?
Is this across the spectrum drugs from, we've already dealt with marijuana, but all the way up to heroin?
Yeah, right up to heroin, absolutely. There are people who've been taking heroin for years, and there's heroin itself, if it doesn't kill you, because it's quite dangerous to take, it has far fewer effects than alcohol. Alcohol causes a whole range of diseases. Heroin it causes constipation, some rashes, and if you don't take too much, you don't die. And the only way you can be sure of not taking too much is if you know what dose is in the actual vial that you're injecting. If you ban a drug like heroin, you don't know what you're getting, and you might take more today or less today, and tomorrow double the dose and you die.
Critics of this, I guess, would say that this is giving a thumbs up to taking drugs, to taking these sort of drugs, to imbibing more, being more inquisitive about them.
Well, of course they've been saying that for years, but let's talk about alcohol again. I'm going to get very boring about this. But why don't we ban alcohol? Because it's the most harmful drug. It kills globally over 3 million people a year, and that's excluding all the alcohol-related accidents and injuries. So we have to be sensible about it. These drugs are all available. The world is awash with drugs. Prohibition of these drugs for the last 60 years has not worked. So we need to legalize it. And also taking a drug is in itself is a victimless crime. If someone drinks a beer, we don't consider that person committing a crime, and the same should be whether someone snorts cocaine, injects heroin, and it sounds counterintuitive, but the point is that the laws are not working, and the money for drugs is totally in the hands of organized crime, and in the Western Cape, we have a situation where the gangs are far more powerful than the authorities, and they run certain areas of the town, and that is because they want drugs to be illegal, because if we legalize them, it takes away their main source of income. And it's interesting, the Western Cape government has been sitting on a report that they commissioned. It took 2 years to formulate. It was given to them in February this year, and a lot of their policies, like calling in the army in the Western Cape, go counter to their own report. And this report, of which I've got a copy, and it hasn't been released yet, is called the Strategic Roadmap for the Implementation of the National Anti-Gangsterism Strategy for the Western Cape. So that is the report, and the Western Cape government is sitting out because they know that their policies that they're implementing in the Western Cape go counter to their own reports. So you need to speak to people like Alan Winde and Albert Fritz, the Minister of Community Safety, because they are being very disingenuous by implementing these policies which are very harmful to the communities they purport to be supporting.
Okay, so I guess two things would happen here. It would improve the quality of the drug if you put it into some sort of framework that you could control, and it would also prevent some of the abuses that we are seeing from the police force on drug users.
Yes, well, you know, once you regulate a drug like alcohol, if you go into a bottle store, you know what percentage of alcohol you're getting if you look at a can of beer or a bottle of whiskey. So you know how much you can drink, and then the purity is controlled. You're not getting contaminated product. Most of the side effects of, say, a drug like heroin are not caused by the drug itself. It's caused by the impurities, the fact that people are sharing needles, they get all sorts of infections. That's not caused by the heroin. So that's exactly what legalization does. And it's interesting, you know, we've legalized cannabis, but it's taken the Constitutional Court to do that because they said it's a person's right to use a drug in their own privacy. So if we can use cannabis in the privacy of our own homes or wherever, why can't we use LSD, ecstasy, magic mushrooms, which are far safer than even cannabis, and cannabis is far safer than alcohol. So we need to get perspective on this and stop demonizing drugs when the drug laws are actually far more harmful than the drugs.
Fascinating. Keith Scott, thank you.